What if the supplement you take every morning to protect your health is actually putting you at risk? Some popular supplements can affect your heart, liver, blood sugar, or medications, especially as you get older. And one of these 5 may be sitting in your cabinet right now. Today, I want to walk you through 5 common supplements that I would be very careful with and explain what you can consider instead. Supplement number 1, potassium. Potassium is an important mineral. Your heart needs it to work properly. Your muscles depend on it, your nerves use it to send signals, and it also plays an important role in maintaining healthy blood pressure. So when people hear that potassium can help with blood pressure, they may think that taking more potassium must be better. But that's where things can become dangerous. Potassium from food and potassium from a concentrated supplement are not exactly the same thing. A supplement can deliver a large amount of potassium into your body at once. For certain people, that can cause potassium levels to rise too high. This is especially important if you take certain blood pressure medications. For example, ACE inhibitors, ARBs, and potassium-sparing diuretics can all increase potassium levels in some people. If someone takes one of these medications and then adds a potassium supplement without medical supervision, their potassium could become dangerously high. And high potassium is not something to ignore. It can cause muscle weakness and abnormal heart rhythms. In severe cases, it can lead to life-threatening heart problems. The frightening part is that some people may not notice obvious symptoms before a serious problem develops. Now, this does not mean potassium supplements are always bad. There are situations where a doctor may recommend potassium after checking a person's health and blood tests. But for many people, getting potassium naturally from food is the better approach. Foods such as beans, bananas, leafy green vegetables, avocados, and potatoes provide potassium along with fiber and other nutrients. The important lesson is simple. Potassium is essential, but more is not always better. Don't take potassium supplements without knowing whether you actually need them. This is one supplement where checking your blood work before taking it can be extremely important. Supplement number 2. Calcium. Potassium isn't the only mineral people can take too much of. The next one is calcium. Calcium is essential for strong bones. Your heart needs calcium to contract properly, and your muscles also depend on it. As we get older, bone loss becomes more common, especially in older adults and postmenopausal women. Because of this, many people automatically assume that taking a calcium pill is the best way to protect their bones. But there is an important point that often gets overlooked. When calcium comes from a supplement, a large amount can enter the bloodstream relatively quickly. Researchers have raised concerns that sudden increases in blood calcium may contribute to calcium deposits in places where we don't want them, including the walls of arteries. Some large studies have reported an association between calcium supplements and an increased risk of cardiovascular problems. That doesn't mean calcium itself is harmful. Your body absolutely needs calcium. The issue may be the way you are getting it and whether you actually need additional calcium. Food provides calcium in a more gradual way and also gives you other nutrients. Good sources include dairy products, sardines, leafy green vegetables, and calcium-fortified foods. So instead of automatically reaching for a calcium pill, start by looking at your diet and discussing your individual needs with your healthcare provider. The main lesson is calcium is essential, but food sources should usually come first. Don't assume a supplement is necessary simply because you're getting older. Supplement number 3, iron. The third supplement is iron. Iron is responsible for helping your blood carry oxygen throughout your body. When someone has an iron deficiency, they may feel exhausted, weak, short of energy, or mentally foggy. Because tiredness is so common, some people simply start taking iron without checking whether they actually have an iron deficiency. That's where problems can begin. Iron follows what we might call the Goldilocks principle. You don't want too little, but you don't want too much either. Your body needs the right amount. Excess iron can increase oxidative stress and inflammation, and may damage organs such as the liver and heart. Another important issue is that the body does not have a simple way to quickly get rid of large amounts of extra iron. If you continue taking more than your body needs, iron can accumulate over time. That's why most adult men and postmenopausal women should not automatically take iron unless a deficiency has been confirmed. How do you know if you are deficient? You get the appropriate blood tests. Taking iron simply because you're tired or because you think it might give you more energy is not a good reason to start a supplement. Food is generally the safer place to start. Iron-rich foods include meat, especially red meat, because the type of iron found in animal foods is generally absorbed more efficiently. Plant foods can also provide iron, although the body absorbs that form differently. Of course, some people really do need iron supplements. This can include people with confirmed iron deficiency, certain types of blood loss, pregnancy, or particular digestive conditions. The important point is that iron supplementation should be based on your individual situation and, when appropriate, blood test results. Iron is necessary, but excess iron can be harmful. Don't take it simply as a precaution. Supplement number 4, niacin. Now let's talk about a supplement that was once extremely popular for cholesterol management. That supplement is niacin, also known as vitamin B3. For many years, niacin was commonly used because it could lower LDL cholesterol and increase HDL cholesterol. On paper, that sounds like a perfect solution. But there is an important difference between improving a laboratory number and actually improving someone's health. When researchers studied the real-world effects of niacin, it did not consistently reduce heart attacks or strokes when added to modern cardiovascular treatment, and high doses can cause significant side effects. These may include flushing, liver problems, and worsening blood sugar control. So even though niacin can change cholesterol numbers, that does not automatically mean it makes a person healthier or protects them from major cardiovascular events. This is an important lesson in medicine. We should not focus only on the numbers printed on a laboratory report. We need to look at the entire person. A better cholesterol number is not always the same thing as a better health outcome. Today, high-dose niacin is used much less often for cardiovascular prevention than it once was. For many people, the potential risks may outweigh the benefits. The key message is, changing a lab value does not necessarily mean reducing your risk of disease. Supplement number 5, turmeric or curcumin. Finally, let's talk about one of the most popular supplements for joint health, inflammation, and healthy aging, turmeric, especially its active compound curcumin. Turmeric has been used as a food and spice for a very long time. It is also widely promoted as a supplement that can reduce inflammation, protect the heart and brain, and possibly slow the effects of aging. That sounds appealing. After all, if inflammation is harmful, it seems logical that completely blocking inflammation would be beneficial. But our bodies are more complicated than that. Inflammation is not always bad. Your body uses controlled stress and inflammation as part of normal repair and adaptation. Think about exercise. When you exercise, especially with strength training, you place a small amount of stress on your muscles. That stress sends a signal to your body. Your muscles repair themselves and become stronger. If you try to block every stress response with large amounts of antioxidant supplements, you may interfere with some of those natural adaptation signals. Some research has raised questions about whether high-dose antioxidant supplements can reduce certain benefits of exercise. This does not mean that turmeric used normally as a food is dangerous. Using turmeric as a spice in your meals is very different from taking concentrated amounts of curcumin every day. High-dose curcumin supplements can also interact with certain medications. They may affect blood-thinning medicines, influence liver enzymes, or cause digestive problems such as nausea and stomach discomfort. And despite the huge amount of marketing surrounding curcumin, we still don't have strong evidence that taking high-dose curcumin supplements will make you live longer or prevent major diseases in healthy people. So if you enjoy turmeric in your food, that's perfectly reasonable. But don't automatically assume that taking large doses of concentrated curcumin is harmless just because turmeric itself is a traditional food. The main lesson is, healthy aging isn't about blocking every form of stress. It's about giving your body the right conditions to adapt, repair, and become stronger. Final takeaway. So, let's quickly review the 5 supplements we've discussed. Potassium can be dangerous when levels become too high. Calcium supplements may not be necessary when you can get enough from your diet. Iron should generally be taken when there is a confirmed need rather than simply because you're feeling tired. High-dose niacin can improve certain cholesterol numbers without necessarily improving long-term health outcomes. And concentrated curcumin supplements may have risks and interactions that many people don't realize. None of this means supplements are always bad. Some supplements are extremely useful when a person has a genuine deficiency or a medical reason to take them. The important thing is to avoid treating supplements as automatically safe simply because they are sold without a prescription. Your body is a complex system. Before taking a high-dose supplement every day, consider your medications, your medical history, your diet, and whether you actually need it. And whenever possible, talk with your doctor or pharmacist before starting a supplement that could affect your medications or blood levels. Healthy aging doesn't come from taking the most pills. It comes from making smart choices that support the body's natural ability to stay healthy. As the old saying from Proverbs reminds us, a wise person doesn't simply believe everything they hear. They stop, think, and carefully consider their next step.